Have you recently been diagnosed with type 2 diabetes? Perhaps you've been diagnosed with pre-diabetes. It's possible that you may be considering medication for this. What if I told you that top quality head-to-head medical studies have demonstrated that a form of intermittent fasting is superior to first-line medication for reversal of type 2 diabetes? I'm Dr. Rawat, a physician who studied nutrition at Harvard and founded website healthgroupcoaching.com. This is a groundbreaking new trial published just a few months ago in the journal Diabetes Care. This study had 3 arms. The first arm did 5-2 pattern intermittent fasting with the low-calorie diet achieved through a meal replacement. The second arm received metformin, the most commonly prescribed drug for diabetes, and the third arm received empagliflozin or Jardiance, again a commonly prescribed drug for diabetes and one of the most effective. The trial ran from November 2020 to December 2022 over 9 centers. 405 patients were randomly allocated to one of these 3 groups. For a period of 16 weeks with an 8-week follow-up, they either received intermittent fasting, 5-2 pattern, metformin, or empagliflozin Jardiance. And the results surprised everyone. The group of patients doing 5-2 intermittent fasting saw the greatest reduction in sugar. In just 16 weeks, their 3-month average sugar came down by 1.9%. For the metformin group, the reduction was 1.6%, and for Jardiance, it was 1.5%. The 5-2 intermittent fasting group also had the greatest reduction in weight. Their mean weight loss was a staggering 9.7 kilograms. For metformin, this was 5.5 kilograms, and for Jardiance, it was 5.8 kilograms. The 5-2 intermittent fasting group were fasting, or rather on a low-calorie diet through meal replacement, on 2 days of the week which were not consecutive. They were allowed in this trial to have about 1/4 of their usual energy intake. On those 2 fasting or fasting mimicking days, they were having an average of 500 kilocalories for women and 600 kilocalories for men. Interestingly, there was also an intervention for the other 5 days. They were allowed to have their own breakfast and lunch, but they had this meal replacement as dinner on those days as well. The patients on the metformin group started with 500 milligrams twice a day, and this was tapered up to 2 grams per day. The empagliflozin Jardiance group was given 10 milligrams once a day, which is the standard starting dose of Jardiance or empagliflozin. This is a graph tabulating the significant weight loss 5-2 meal replacement fasting had compared to the other 2 drug groups. In fact, as you can see on this table here, 22.2%, which is almost 1 in 5 of the 5-2 intermittent fasting group lost over 15% of their body weight. That's a significant loss of body weight, no matter how you look at it. The 5-2 fasting group also had a significant reduction in 3-month average sugar, and they also had a significant reduction in fasting plasma glucose. This is this table comparing 5-2 fasting to metformin. And as you can see, regardless of sex, BMI, weight, waist circumference, or initial fasting glucose, 5-2 fasting was found to be more effective than metformin. Interestingly, the only one group in which metformin was found to be more effective was in those aged above 60. And generally this would be because these are clients who've had diabetes for longer, and as a result, they're suffering from not only insulin resistance, but also a degree of insulin lack due to beta cell dysfunction. And this is something we also saw in Professor Roy Taylor's work. The weight loss was less effective in clients who'd had diabetes for over 15 years. The table on the left compares 5-2 fasting to Jardiance and empagliflozin, and the same pattern again. 5-2 fasting is more effective in every group apart from those who were aged above 60. The table on the right compares metformin with empagliflozin, and for all parameters, metformin was actually slightly more effective than empagliflozin. I would like to highlight, however, that Jardiance starts at a dose of 10 milligrams, which was given in this study, but is also available in a higher dose of 25 milligrams. In fact, I very often use a combination tablet of these two called Synjardy. Some more interesting things in this study. Here they talk about how it has been shown in animal studies that fasting reduces inflammation. This could be partly by reshaping the gut microbiome, promoting the browning of white adipose or fatty tissue, which then has an effect on reducing insulin resistance. The meal replacement in this study also contained omega-3 fatty acids, and these have also been known to regulate leptin, which is your satiety hormone, inhibit or downregulate the synthesis of fat, promote the breakdown of fat. Here they note that 5-2 intermittent fasting showed a more significant and sustained weight loss as well as reduction in waist circumference. And here they talk about how the direct study by Professor Roy Taylor at Newcastle University confirmed the basis of diabetes, which is caused by excessive fat accumulation in the liver, pancreas, and muscles, which leads to insulin resistance development in a genetically predisposed individual. So an individual who is predisposed to preferentially store fat within the viscera or internal organs rather than storing that fat in safer sites like subcutaneous fat stores under the skin. This is related to genetic factors and influenced by ancestral factors, as we discussed in our previous video, including the thrifty genotype hypothesis postulated by Professor James Neal at Michigan University. If you're interested in finding out the genetic basis of metabolic disease, then do watch my previous video on intermittent fasting. They also noted that 5-2 intermittent fasting reduced blood pressure, reduced total cholesterol, and also increased good cholesterol or HDL levels. In conclusion, this randomized control study found that in patients with newly diagnosed type 2 diabetes, a 16-week intervention of 5-2 meal replacement intermittent fasting would improve sugar control, lead to weight loss, while also improving blood pressure, triglyceride levels, and HDL levels. So what are the practical ways of implementing this? I do recommend that you should practice early time restricted feeding 5 to 6 days a week, focusing on consuming food early in the day during daytime hours. If you would like to know more about the benefits of doing this, please watch my previous video on intermittent fasting. Consume dinner as early as possible and try to make that last meal a low-calorie, low-carb meal. Remember that even in this study, while they had to eat that meal replacement 2 days of the week, even on the other days, their last meal was the meal replacement. On 2 non-consecutive days of the week, consider a very low-calorie intake. Personally, when I do this on consecutive days, and that's called the 60-hour fasting mimicking diet, or if you do this on 2 non-consecutive days, in which case this will be called the 5-2 diet, I recommend limiting calories to about 900 a day. Of course, in this study, it was 500 for women and 600 for men. The results may be a bit slower, but this would be a lot more manageable. Personally, when I do this, I'm able to cap it at about 600 calories a day. But as a starting point, if you'd like to start at 900 and work your way down, that is completely achievable. It is important that those 2 days when you're restricting your calories to under 900 calories a day, they do have to be non-consecutive, and clearly these should not be gym days. Personally, what I do is I go to the gym in the mornings on Monday, Wednesday, and Friday. And so if I were to do the 5-2 diet, it would be on a Tuesday and a Thursday that I would be limiting myself to under 900 calories. But I wouldn't do this by using some kind of a meal replacement. I would simply download the MyFitnessPal app, track my calories, and keep it under those 900 calories. As I said, I'm usually able to keep it below 600 calories. And even if you do start at 900 calories, over time, you will be able to limit the calories even further, particularly if you're interested in accelerating the whole process. Make sure you read my blog on healthgroupcoaching.com and consider certain low-calorie meal replacement strategies. Buy primarily whole food single ingredient items And these would mostly include frozen vegetables, frozen fruits, tinned fish, etc. Cook this primarily by steaming, air frying, grilling, baking, but minimize the use of oil. Personally, I don't use oil at all if I'm trying to minimize my calories to that extent. Consider adding protein and collagen powders to your meals and drinks to maintain adequate intake. For some people, it may well not be convenient for them to fast 2 non-consecutive days. So as an example, going to the gym Monday, Wednesday, Friday, and then doing under 900 calories on the Tuesday and Thursday. For some people, for whatever reason, that might not be convenient, and they might prefer to do that low-calorie plan on 2 consecutive days. And that would more or less then fit in with my 60-hour fasting mimicking diet challenge. In my case, I start Friday 7 p.m., finish Monday 7 a.m., limit myself to 900 calories on the Saturday and again on the Sunday, which makes it 60 hours with just 1800 calories. But you could really do this any way you like. You could start, for example, Monday evening, keep yourself at 900 calories for Tuesday and on Wednesday, and finish Thursday morning. It would be more or less the same thing. There are certain patients who have to be very careful with this, and these would particularly be diabetics on insulin or diabetics taking sulfonylurea type medication, which can increase the risk of a low sugar or hypo attack. These would be drugs such as gliclazide, gluburide, etc. And these clients should definitely be speaking to their physician or pharmacist before embarking on anything like this. You will need some support during this kind of process, and the best way to do that is watch my shorts on YouTube. I do post regular shorts when I'm doing these kinds of challenges. Comment on those shorts and share your experience. You can also join the Reddit forum where you could share pictures, calorie screenshots, meal plans, and weigh-ins. These are all completely free resources, and the kind of support you get on these forums will help you stay on the plan. This is not a comprehensive list, but consider buying whole, intact, single ingredient items like mixed vegetables, cucumbers, tomatoes, lettuce, spinach, frozen berries, fruits, particularly those which are watery and less dense, low calorie, low sugar, canned food like beans or chickpeas, fish, high protein, low fat yogurts like Too Good by Danone, which is the one I use, pitted black olives, pumpkin seeds, chia seeds, large flake or steel cut oats, unflavored soya milk. And rather than using a meal replacement, we simply download the MyFitnessPal app, and before you eat anything or even prepare anything, calculate the calories and just make sure you stay under 900 calories for those 2 days, whether it is 2 consecutive days as with the 60-hour challenge or 2 non-consecutive days as with the 5-2 plan. I will highlight here some more resources that you might not be aware of. On my website and blog, I do have videos featured on weight loss. This is over 1 hour in content. There are natural ways of improving the diversity of your gut microbiome that includes increasing the consumption of fermented foods. That could be yogurt, kefir, paneer, kimchi, kombucha, sauerkraut, tempeh, miso, homemade pickles, increasing consumption of fiber. That would be nuts and seeds, legumes, lentils, beans, whole intact grains, quinoa, brown rice, increased consumption of plant proteins like soy, edamame, tempeh, chickpeas, black beans, peas, brown rice, and reducing consumption of refined sugars, that's white bread, white rice, anything coming out of a bakery, such as cakes, croissants, cookies, donuts, reducing consumption of saturated fats, that is deep fried food, red meats, solid fats like ghee and butter, and reduce consumption of ultra-processed foods. These are factory-made food products which typically have over 5 items on the label. There are certain probiotics which have shown benefit for weight loss. This is a randomized control study which showed benefit of this particular probiotic. And this probiotic also has some scientific evidence which was published in the journal Lancet. This is that particular study. Increasing fiber in the diet through whole grains, fruits, vegetables, legumes, and nuts also has some weight loss benefits. And Metamucil has some scientific evidence to back it up. This is a study comparing psyllium husk or Metamucil to placebo for constipation, weight loss, and reduction in sugar and reduction in cholesterol. And this is another study showing the benefits of psyllium husk for improving sugar control, reducing body weight in type 2 diabetics. Increasing the amount of plant protein also has benefits for weight. I like this particular one, and the Amazon links can be found on my blogs. It contains vitamins, minerals, and probiotics in addition to plant protein. Of course, the amount of probiotic, which is 1 billion CFU per scoop, is not nearly enough compared to the earlier probiotics we discussed, which were several billions of CFU. On my coaching program, I'd like to discuss the protein leverage hypothesis. And if you would like to read up on why it is important to prioritize protein when on a weight loss journey, then you can find the link to the study on my blog. You will also find Amazon links for certain types of low-calorie food items like shirataki rice, noodles, spaghetti, and pasta. This is made of konjac flour, which has a very high amount of insoluble fiber, so it essentially passes through you without getting absorbed. A bowl full of this rice would be about 25 calories compared to standard rice, which would be 200 calories. On my blog, you'll also find links to various condiments by Walden Farms, which are 0-calorie condiments. I'd highly recommend you check the Amazon reviews for these because some of them taste decent, but some of them are not really that good a replacement. When fasting, is really important to stay hydrated. Particularly in my case, my 2 fasting days are often my cardio days, so I do play tennis, often an hour or 2 hours on the days that I'm limiting myself to 900 calories. And it's certainly really important for me to have something like a 0-calorie Gatorade to replace those electrolytes. I really like this $40 Smart Scale, which gives you your body fat percentage. And if you don't have a food scale, consider buying one, as it will really help you accurately gauge the amount of calories in your food. In summary, metabolic disease like type 2 diabetes, pre-diabetes, fatty liver, obstructive sleep apnea, central obesity happens due to excessive accumulation of fat within the organs, within the liver, pancreas, and muscles in a person who is genetically predisposed to this. So the treatment of this is to get rid of that excess fat. This is what the twin cycle hypothesis by Professor Roy Taylor postulates. And by doing that, you would be treating your condition at the root level. This is an analogy I like to use with my clients. Metabolic disease often is a disease which has a root cause, but the symptoms are like the leaves fading on the branches. Real treatment of these conditions would be by treating the root cause. A lot of the time, the medication we give you is like spraying pesticides on those leaves. And so it should not come to you as any surprise that even within a short period of 16 weeks, a lifestyle program, which in this case was the 5-2 meal replacement intermittent fasting protocol, was more effective than the top 2 most commonly prescribed diabetes medications for weight loss, for sugar control, as well as reduction in blood pressure, reduction in sugar, reduction in inflammation, reduction in triglycerides, and increase in HDL. Although a lot of people will find this surprising, it should not be surprising, because if a tree is ill and the problem is coming from the root, surely treating the root cause would be more effective than applying sprays on the leaves. When a person is diagnosed with diabetes, on average it takes 6 to 7 years for that person to move to taking injections to control their condition. When a person is diagnosed with fatty liver, on average it takes 5 to 7 years for that fatty liver to turn into the next grade of fatty liver. So even if you're not able to completely put your condition in remission, making significant lifestyle and dietary changes will slow down the condition and delay the onset of you having to take stronger medicines, injections, or developing conditions which may be irreversible. I hope you found the video useful. Make sure you share it with friends and family who may benefit from this information. Consider subscribing on the program, read the blogs, join the Reddit, subscribe to this YouTube channel. If you would like to know more about how to reverse prediabetes and more about an ultimate intermittent fasting program, then click on the videos above and I'll see you there.